So you're out on the mound and feeling that familiar ache creeping into your shoulder every time you throw. Maybe it's a pinch, maybe it's a dull throb, but either way, it's probably holding you back. So shoulder pain in pitchers is so incredibly common, but it doesn't have to be a career killer. In this video, I'm gonna break down exactly why your shoulder hurts when you throw and what you can do to stay on the field pain-free. Let's dive in. What's up, guys? If you're new here or don't know me, my name is Dr. Cam, and I'm a double fellow and residency trained sports, orthopedics, spine, and manual physical therapist, as well as a faculty member in a doctorate of physical therapy program. On this channel, I do provide with strategies and tools to get you to throw hard and stay healthy. Throwing a baseball is one of the most intense movements your shoulder can perform. In fact, the act of pitching is so violent that your shoulder can reach speeds over 7,000 degrees per second, placing extreme forces on every structure in the joint. That's where something called the thrower's paradox comes in. Your shoulder has to be both incredibly mobile and achieve full range and stable enough to handle these forces without it breaking down. Each phase of the throw, from the wind up to the follow through, relies on fine tuning the kinetic chain that starts at your legs and moves through your core and ends at your arm. If there's even a small breakdown at any length, like poor core stability or scapular control, it shifts extra loads to your shoulder, and that's where injuries start. And honestly, that's why you probably throw slow. Let's talk about the biggest culprits behind shoulder pain in baseball players. First, there's the rotator cuff. The group of muscles stabilizes the shoulder joint during intense motion, but the repetitive force of throwing creates microscopic damages that can lead to inflammation, or known as rotator cuff tendinitis, and eventually to partial or full tears. Interesting, research shows that rotator cuff tears in pitchers often occur on the underside of the tendon, right where it rubs against the top part of the arm bone or the humerus. Another big factor is something called glenohumeral internal rotation deficit, or GIRD. Some people are stopping to talk about this, but I thought I'd bring it up because it's still taught at the PT school curriculum. It's still taught worldwide. Here's what happens to the posterior shoulder as the capsule starts to tighten up, especially in throwers who don't stretch all the time. Over time, this limits internal rotation and leads to labral injuries. Studies have actually found that at about 60% of pitchers who have GIRD of at least 35 degrees develop shoulder pain severe enough to sideline them from the season. Then we have scapular dyskinesis, or improper movement of the shoulder blade. Your scapula tends to move smoothly to support each phase of the throw, especially during the cocking and acceleration phase. And if it's misaligned, known as a sit scapula, which stands for scapular malposition, inferior medial border prominence, coracoid pain, and dyskinesis, pain and instability often follow. Diagnosing shoulder pain is complex, especially when pitchers. Each part of the shoulder joint can have a unique issue, and we need to look at factors like scapular movement, neurovascular compression, and joint stability. I'll often take a complete pitching history, noting exactly when the pain occurs, what type of pitch causes it, and what phase of the throw is affected. For example, if a pitcher feels pain during the late cocking phase, when the shoulder is at maximum external rotation, it often can indicate issues in the posterior labrum or where the bicep anchors, as these structures absorb high level of force in that position. The best way to keep pain from derailing your season is early intervention and prevention, and that's why I advise people to come to me often. Off-season conditioning is key here, with particular focus on rotator cuff and scapular stabilizing strain, along with flexibility to prevent internal rotation deficit. One critical exercise is this sideline cross-body stretch, which specifically targets the posterior capsule and can be incredibly effective at reducing GIRD, such as the glenohumeral internal rotation deficit. Studies have shown that targeted posterior capsule stretching can resolve GIRD in 90% of pitchers, allowing them to maintain internal rotation without putting extra stress on the labrum. If shoulder pain has already set in, conservative treatments are usually the first line of defense. Rest and strategic rehabilitation exercises and adjustments and pitching mechanics can often alleviate pain. Surgical interventions are honestly a last resort, and the data here is sobering. Only 8% of professional pitchers who underwent a full thickness rotator cuff repair returned to the same level they were at before the injury. 8%, that's crazy. This is why it's so important to focus on building strength in the rotator cuff, restoring improved scapular control, and correcting mechanics before pain progresses to a surgical issue. Long-term shoulder health requires a strong foundation of strength, flexibility, and functional mechanics. The throwing motion depends on efficient energy transfer through your kinetic chain, starting from your legs, flowing through your core, and finishing with your shoulder. If there's even a slight issue anywhere along that chain, your shoulder ends up picking up the slack, which is honestly a recipe for injury. Consistently training these areas in the off-season and paying attention to changes in your shoulder mobility and strength can help you stay ahead of your injury. To wrap it up, if you're feeling shoulder pain when you throw, focus on prevention, early intervention, and conditioning. Maintain good mechanics and stay on top of your shoulder health with regular checks. Have somebody do it. Don't ignore signs of pain. By addressing it early, you're much less likely to end up needing a surgery or missing part or all of your season. Drop a comment below if you dealt with shoulder pain or have any questions. I'd love to help. And just remember, I'm Dr. Cam and I got you.